What does public health do for sex workers? I mean, what do we really do? Sure, we recognise sex workers to be a marginalised group of people with greater vulnerabilities and access needs. We run sex worker-friendly clinics. We give out condoms. We test for STIs. We prevent and we manage communicable infection. We design studies. We collect the data. And we write up our findings. And if we really understand our epidemiology, we recognise the high incidence of violence, both sexual and general violence, amongst the sex worker population, and we might design and implement strategies for safety and support. And then we give out more condoms, and we test for more STIs, and we design more studies, and I think you get the picture. Now, I'm not saying that there's no value in this. Pretty much every sex worker I've ever met has been thankful that such services exist when they need them. But there's a bigger conversation, and one that needs to take place, and it moves beyond the sex workers as vectors and victims trope. And we, as public health professionals, need to be part of it, because to remain silent means that we become complicit. And if we are complicit, it means that we contribute to the harm and the stigma faced by sex workers all over the world. I want to talk to you about why, if we are truly serious about tackling health inequality, the full decriminalisation of sex work should be a topic for public health. Then you'll be armed with the knowledge that you need to go back to your public faculties, your hospitals, your commissioning roles, your educational establishments, and you'll be able to have these conversations, and you will seed the ideas that will make you part of the change. Now that's a contagious idea. And what is it we want to change? Just the law. To be precise, it's the current set of laws that criminalise sex workers and create the climate in which their health and well-being is harmed every day. The law that prevents them from taking the condoms that we provide in case the police find them and arrest them, because condoms can be used as evidence. The condoms that prevents them from accessing the clinics that we run because they're fearful of giving over their personal details to people that they perceive to be part of authority. And the law that prevents them from reporting crime that's happened to them because they are fearful that if they try to seek justice, they will be criminalised instead. The sale of sex under UK law is not illegal, but everything else associated with it, advertising, organising, working together, it is illegal. We see versions of this sort of criminalisation all over the globe, and it's very disingenuous because it puts sex workers in a situation where it's virtually impossible for them not to break the law. When sex workers, so these are individuals who live complex lives within grey areas of the law, have become victims and they seek redress for this, the police often struggle to make an appropriate response. They move towards an examination of the sex workers' lives and a judgment about what they do, rather than the crime that's actually happened. The message that sex workers take away from this is that they are not deserving of protection of the law, and as a consequence, they are fearful to report to the authorities for fear of judgment and prosecution. And it also means that they distrust other services, fearing that the authoritarianism of the law is likely to bleed into other professionals. Now, for 13 years, I ran a large NHS service in East London, and I've seen at first-hand the barriers created by criminalisation facing many sex workers when they try to access our support. By providing free and confidential access to healthcare, advocacy and support, the service I ran was able to assist people when they needed it. Sex workers could come knowing that they wouldn't face moral judgments or anti-prostitution ideology, and where they knew that if they came to us, they'd have a team who would be working hard on their behalf to navigate the complex set of laws that they needed to get through in order to access public services in the UK. One of the first questions we would be asked by sex workers, particularly migrant sex workers, was how did they know they could trust us? Because in their home country, health services are always linked to the police. And it didn't matter how hard we tried to reassure them. If the woman that we were meeting had been part of a police raid, their brothel had been raided, and had their ID taken, and they'd been told, if we find you and you're working as a prostitute again in the UK, then you're going to be criminalised and deported. No matter how much we impressed upon them that we were different and we weren't the police, they couldn't trust us. And no wonder they couldn't use our service without absolute proof that we were a safe and confidential entity. They were too fearful of their details being shared by the police. In a large borough elsewhere in East London, my team would give out condoms to sex workers, and they would refuse to take more than 6, and we would see them running off and hiding the condoms in bushes and behind walls, and we'd say, why are you doing that? And they'd say, because when the police arrest us, they use the condoms that we have on them as evidence for prosecution. National Ugly Mugs is the organisation that I work with, and we promote safety and access to justice for sex workers who are often targeted by dangerous individuals. And they're reluctant to report to the police because they're fearful that if they do so, that the police will disregard what they're saying to them. We make reports, we produce anonymous reports that go out to other sex workers, and we then enable sex workers to also get in contact with the police and make a full criminal report. We also put them in touch with frontline support services. With their consent, we share that intelligence. Now, the fact that National Ugly Mugs exist is a testament to the basket case that is the UK law. What other group of people require an interface between themselves and the criminal justice in order to be taken seriously, in order to make a report because they've been victims of crime? As statutory funding for public health dries up in the Northern Hemisphere and the neoliberal market takes its place, partnerships between NGOs and faith-based organisations and the police emerge. Now, these alliances are not new phenomenon. If you're a sex worker in Southeast Asia, you will long have been used to the brothel raids that pull you out of the place that you're working and put you somewhere that's deemed more suitable for you as a woman. In the UK, we're increasingly seeing the language and the actions of enforcement supported by helpers, ostensibly there to rescue and rehabilitate sex workers happening across the UK. And regularly, these brothel raids and these street arrests happen with these helpers in tow with the police. And what they tend to do is ask that the sex workers work with them and engage with them. They see the problem of sex workers antisocial, and the sex workers themselves are characterized as deviant, and what they do is conflated with either victims of trafficking, or they're told that they need to accept the support, otherwise they'll face criminal sanctions. Now, the reasons that we should care about this as public health professionals is that sex workers think that we're all the same. They don't differentiate between public health services that operate within the boundaries of confidentiality and impartiality, and we would never sanction or hand people over to the police if they disengage with our service. So it becomes increasingly more difficult for public health professionals to press home the point that we're here to listen and not to tell. Because why would sex workers believe us? Any form of criminalisation drives sex workers underground. It's what I've seen year after year of running sex worker services. Sex workers in need of help and support who come late to services or not at all to seek treatment for health problems that would have been simple to sort out if they'd have come to us earlier, but they're hiding from authorities. The trend towards authoritarianism and the creeping enforcement helps us to really understand how the system is trying to manage what they see as undesirable behaviour. And this particularly looms large if you're working in public health in the UK today. Our commissioners are part of local government machinery, and their objectives are set by elected representatives, who in turn are voted in by members of the general public. And the understanding of risks inherent of pushing sex workers away from services and treatment is of little interest. What counts is gentrification, enforcement targets, and cost effectiveness. What simpler way to deal with sex workers than enforce them out of sight? When it comes to developing services for people who are marginalised, we like to think as public health professionals that we are creative. The move towards authoritarianism in public health now sees reductionist thinking. We recognize the connectivity between mental health and physical health. We recognize the interrelatedness between structural and environmental factors, and we try hard to reflect the lived experience of sex workers when we design services with them and on their behalf. The new breed of authoritarian helpers lack the passion, they lack the training, they lack the knowledge, they lack the skills to calibrate the level of emotional support and practical support that's needed by sex workers. And they push as their remit requests their own targets, their own target-driven initiatives. The structural changes in health and community-based services means that there's a high staff turnover and there's stigmatization very often because services are amalgamated and a one-size-for-service is meant to fit all. Sex workers' specialist understanding is not there, and so sex workers simply stop using services. In discussion recently with a colleague, she was describing some of these developments, and she said, I was talking to a woman who was working for one of these helper organizations, and she said that a sex worker had come to her who'd been raped. And apparently the colleague had said to her, I don't understand why you still do this job. Why don't you just go out and beg? Now, there's a perverse consequence to all of this. The further sex workers move away from support and services, then the more unwell they become. And when they eventually come to clinics with acute care needs, this requires and it legitimizes our treatment of STIs, our management of outbreaks, handing out of condoms. Ever felt like you were part of a system that was perpetuating the ill health of people? Because I know that I did start to feel like that. My point is that if as health professionals we aspire to offer meaningful protection for sex workers around the world, then we must marshal our arguments and we must use our professional status to advocate for full decriminalization. It's not good enough for us to think that just giving out condoms and promoting safer sex should be the limit of our involvement. We have to speak out about the fact that the law creates appalling barriers to health and criminal justice. Redoubtable institutions such as the UN, the World Health Organization, and Amnesty all call for decriminalization. But change starts with us, the little people. It starts when we're sitting in meetings, when we're talking to our commissioning colleagues, when we're talking to our medical colleagues. And we have to keep in mind how these terrible laws impact on the poor health outcomes and the better health outcomes that we would like to see. It's not good enough to produce data that simply reflects back the biomedical harms that we see. We need to grapple with the context and the politics. We need to create a climate for sex workers in which poor health and discrimination and stigma is not the norm. My aspiration is that all health professionals become empowered enough to challenge the authoritarian thinking that criminalization is the answer to sex work. Increasingly and thankfully, sex workers across the globe are campaigning and devising their own services. They want to see sex work decriminalized, and they know that it will make them healthier, and they know it will make them safer. And public health needs to join forces with them on the front line, because if we support the policy of the principle of policy made through evidence, then the decriminalization of sex work is a contagious idea that we need to see.